This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's another edition of Health Watch right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will discuss today here on the program the who, what, when, where, why, and how. Got that? Of Innovative Medical Associates and how it can potentially help you and anyone you know improve your overall quality of life. That is our mission statement here on the program, and we continue it today as we do every week. 855-839-1210. That's the number here in the studio, 855-839-1210. If you have a question for Dr. Molly or you have a medical challenge that you'd like to run by her, this is the time to call, 855-839-1210. And as always, Dr. Molly, we welcome you. It's good to have you here again.
Oh, John, it's great to be here.
Do you have anything new to say about Innovative Medical Associates?
Well, I think...
except that what we always say, but people always say, well, what do you do? And
how do you do it?
We say it every week, but
yeah.
What do you do?
Oh, John, you know what? I never get tired of saying, what do we do? Because what we do is pretty unique. What we are is a group of like-minded professionals who actually, healthcare professionals, who actually got together, and we do have a situation where we work together out of my primary care facility. So that gives us the opportunity to do anything a GP office might do. And as a matter of fact, it probably allows us to do more, because if you need a prescription, we write prescriptions. If you need radiology, we get radiology. We have laboratory services right in our facility. And everybody's philosophy is, look, you want to do the best for the patient, whether that entails traditional medicine or Western medicine, is like meaning drugs, or you need to do something with more natural products. Why do we like natural products? Because it can help us reduce the need for pharmaceuticals, thereby lowering the odds of having some adverse effects to these pharmaceuticals.
You're a big believer in nutraceuticals.
I am.
And you have been for many, many
27 years. Maybe Linda will correct us if she's listening. Maybe it's 28. I don't know.
Okay. Mm-hmm. What's the difference? 27, 28?
Not right.
It's been a long time.
It has been. It has been.
But what do you attribute the fact that you've emphasized nutraceuticals all this time?
I think the reason is my approach is maybe a little different than, let's say, many other people in this kind of business. I know hydration works. That's our vehicle for delivering these nutraceuticals. By utilizing nutraceuticals, mostly I'm looking at the constituents of these nutraceuticals that actually can effectuate the change for the patient. You know, many places you go in, you get a consultation with the professional. They give you a list of products to buy. You go to the health food store, you buy the products, and invariably they fail. And why is that? Not because the products are bad. No, it's because you're just not getting enough of the particular constituent in that product that can effectuate the change for that patient.
So the question becomes, how much is enough?
Or how much is too much?
Or people don't know, because
exactly. This takes time.
The clerk will say, "Take 2 of those. Take 2 of these."
Well, just look at the bottles, right?
Yeah.
And it tells you what, quote unquote, the normal dose is. But I find that the normal dose is not enough sometimes, and maybe the normal dose is too much. Here's the delivery system. It goes through your digestive tract. You're going to lose some of that potency in your gut. No matter what you say, our gut is totally important to us. So what do? We believe in hydration. Using hydration as the vehicle to deliver certain nutraceuticals that can effectuate the change actually does work.
And it really does work.
Oh, it does work.
I'm a walking poster boy for.
You are, because you have a multitude of issues. And, listen, some of it is just living as long as we have, right?
Yes,
In this environment. Others are genetic. Some others is just the way we lived our younger youth, John.
Yes.
Come on. So, yeah, of course. But the idea is you want to put together the best possible protocol for each individual patient. And again, I'm not telling you that we don't recommend oral products. We do. Any more than I won't tell you that we won't recommend pharmaceuticals. We do. Our use, though, of the pharmaceutical is pretty interesting because many times we'll use low doses. We'll use subclinical doses. We may use repurposed medication. But I'm going to tell you, using it in conjunction with a great protocol of natural God's ingredients. And the other thing I'm very, very strongly inclined to do is utilize these natural products as God's ingredients products, meaning extracted from food source.
Now the question that you always get.
Yeah. Does it work?
Does it work? Hydration, does it work?
Sure it does. Hydration alone is a medical modality. Get yourself the last few weeks with all of this particular kinds of temperatures that we've been having, right? In the hundreds. People came into me totally dehydrated. I can't tell you, we've had maybe 3 to 5 people walk into the facility who were recommended by their doctor to get hydration right away. Couldn't get it at the ER because it was backed up. So we did it for them.
And that's just one example of how
what we did is we actually enhanced their hydration. In fact, they said, "Oh my God, I haven't felt this good." I said, "Come back for the protocol."
We can do a whole show or more on telling stories of people who have been helped by your hydration therapies.
Right. Well, you know what's interesting, John? I just did this week several pregnant women who in the first trimester are having what? They're having the nausea and the vomiting, and they had to get back to work. So, of course, the OB said, well, you can go to the ER. That's a covered process. That's covered by your insurance.
Yes.
But you got to wait 3-4 hours, whatever, right? Yeah. You come into our facility. They came in, we seated them right away. We had to take a medical history, obviously, because doctor had to give the order. But we spoke to the OB, we started the patient, we stopped the nausea. She got back to work by 10:30. She said, I can't thank you enough.
How about that?
She was an attorney. She needed to get to court.
How about that? Well, that's where it worked quickly.
Right.
But for the most part, what do
No,
you
for
see?
the most part, 5 to 10 weeks, maybe 15 weeks. And some people are going to be lifers, John. You're a lifer, man. Because we're always switching up protocol, right?
Yes.
I mean, so if you come to us with a cancer situation, obviously we've got to do a more intense type of protocol for you. And we do. But if you're coming in for diabetes, you need an intense protocol. Most of the patient, look, we are not a spa. You're not coming in to look pretty. I want you to look pretty. When you leave, you look nice. I'm not saying that. I'm saying we don't actually dwell on the fact of spa-like processes. We are looking to enhance whatever syndrome, problem, or just overall wellness you need for as a particular patient with particular challenges. And so that's very, very different.
On average, what can you expect? What can a new patient expect? How many treatments?
Depending, again, where they are in their continuum of their particular challenge, somewhere between 5 and 13 weeks.
And that's really not bad.
No, because what happens most times, people come in with one complaint. What we find out is they start to feel a little better. Guess what? They have an underlying complaint. And we usually do this by using the archaeology of their charts from previous physicians. We know that you may come in and say, oh, I have this problem, and we find out that your problem is actually more complex. And this is why you're on all these medications, and we review the charts.
Are people, do you find, for the most part, on too many medications?
I won't say too many, but boy, oh boy, the pharmaceutical companies have inundated us right now, particularly with the biologics, which we'll talk a little bit about in the next segment. But it's been inundated with all of the new, molecular drugs that have come out. And believe me, I'm a scientist. I believe in them. I believe in what you need to do to eradicate your symptomatology. I'm not telling you we can cure your condition, but I'll be darned, John, if we can't get you to have better quality of life, whatever that is for you. I had a Parkinson's patient this week. I changed up the protocol a little bit. And he started to wave to me. He's in a wheelchair. You might have been there. Were you there for that patient? Yes. The daughter comes in from New York. Anyway, to make a long story short, I was utilizing a particular protocol, and there's a million protocols out there right now, but I make a little nuance to this, and I'll be darned if this guy didn't look a whole lot better when he left. Now, did we cure Parkinson's? No way, no how. But putting a combination of a low-dose particular medication and this protocol, I think, really is working for him.
It's quality of life.
Quality of life,
that's your
exactly.
Goal. We are coming up on our first break of the morning. The show is Health Watch every Sunday, the live version, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly or a medical challenge you want to run by her? Now's the time to call. We always tell you, call early so we can have plenty of time to talk to you. 855-839-1210 is the number. 855-839-1210. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, when we're on the air, and even when we're off the air, the operators are standing by at Innovative Medical Associates. And the number, 856-489-0505, 856-489-0505. When you call, all you want to do is make the initial appointment, the initial consultation with Dr. Molly. Make that appointment. It is complimentary, and you will learn a lot, and you will find out whether this is for you or whether Dr. Molly can help you or not. It's very simple. 856-489-0505. And the website. A lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. That's the website. Our show is Health Watch, Sundays, 8 till 9 here on Talk Radio 1210, WPHT. And Dr. Molly, you're going to get into something a little different. I understand you're going to talk about autoimmune, but oral health, does that have anything to do with
you bet, John. Isn't that something? Yeah.
I never thought that this would.
Hey, listen, you know how I send my shout out to all my compounding pharmacy friends, but I also have a lot of dentists who are both patients and friends of the clinic. And, they're very vital to our overall health and quality of life.
Yes.
You know that.
Yes.
But this is interesting. I researched an article just recently because I actually have a new patient who is starting with me who has one of these autoimmune disorders of oral in nature. And I did this research. It came out of the University of Rome, the Spina College of the University of Rome. And the scientists there, it wasn't the physicians, the scientists were looking at mouth sores and things like that. And they actually discovered in their research that autoimmune diseases, the signs and symptoms may actually start in the mouth.
How about that?
That's very something. So how do these oral manifestations of autoimmune disease look like, and what are they? Well, there are many, okay? One is called lichen planus. And, I've talked about Lechen's disease before when I've seen it in mucous membranes in the genitalia. But this can occur when the immune system attacks the mucous membranes in your mouth as well. Obviously, if it can hit other mucous membranes, it can attack your mouth. And it appears as white patches, sometimes accompanied by painful sores on the lining of the cheeks, tongue, and gums. So with me saying that, what do you think is a great way to deliver your remedies for your quality of life and bypass your mouth?
I would say hydration.
Amen. And that is why I'm interested in this. And I was interested in it before. But my new patient actually is coming to me with another type of autoimmune. It's called Pemphigus vulgaris. Now, this is interesting because he went to 10 different, honest to goodness, large organizations before someone really realized, after taking the biopsy from his mouth, that was characterized by blisters in the outer layer of the skin and mucous membranes, right? It usually starts with blister formations in the mouth and esophagus, but it can also occur on the scalp. So this is fascinating because it goes to what I talk about all the time, which is people come to me with very weird type of syndromes, and it's like, what kind of condition do I have? Well, we don't know. Sometimes we just don't know. But I'll tell you what, sending him to a really good oral dentist, a specialist in these types of things from a prominent healthcare facility, he was able to find out, okay, they're soft and they're easily broken, but they may be painful but not itchy. Isn't that interesting?
Yes.
Okay, so here we go again. Blisters in the mouth and throat. It makes it hard to swallow. So how's another way to deliver this? Hydration.
Yes.
Hydration. Another disease that's out there is called Behçet disease. According to several of the research articles I looked at from PubMed and Mayo Clinic, this is a very rare disorder, and it affects blood vessels, which is interesting because I think I have a patient who had this and had to go to Mayo Clinic to find out that he had it. It really causes blood vessel inflammation everywhere in the body, right? But it can start with painful mouth sores. Okay, they look like canker sores, but they're really predominantly an inflammation process, and they begin as raised lesions. And actually, this patient came to us with those, and the medical director took a look at him and said, I'm really not sure, because there was a history of herpes in the family. He had a history of herpes, so of course it could be a herpes virus or whatever. But we found out that he was feeling better after a short course of hydration that included things like turmeric. And so she put two and two together and she said, hey, Molly, we better send him out. And indeed we did. And we came back as this particular condition because it affects all the blood vessels.
So the question becomes, how do you know if you have an autoimmune problem? How do you know that it's caused by oral health? I mean,
the first thing you got to do is get in to see your dentist and make sure that you're in good oral health. The other thing is, listen, lots of times, we hear all the commercial about gingivitis. Well, what the heck is gingivitis? It's inflammation of the gums, right? You know what I mean? And so, I laugh when people say, well, I have gingivitis. Okay, are you brushing your teeth? Are you using dental floss? I'm not a dentist. I don't pretend to be one on TV or elsewhere.
Right.
Okay, but the idea is you've got to have good oral hygiene. And from that, then you can make a jump. But one of the things I can tell you is that some of the more traditional autoimmune disorders can affect your mouth health. One of the reasons things be lupus. Now, I have a patient who has lupus, systemic lupus, and that can affect, it's chronic inflammation that can affect all the body's organs, okay, and systems. So don't you think that could indeed cause inflammation in the skin and in the mucous membranes? The answer is yes. So when you have a lupus patient, do we have a protocol for that? Of course we do. And does it entail hydration? Yes. And it includes what? The anti-inflammatories, things like turmeric, things like ginger, things like omega-3s, things like B complexes, especially the methylated Bs. So we're looking at that type of conditions when you have systemic lupus. Also, everyone knows Sjögren's syndromes, right? It affects the entire body. It has dryness. It can give you dryness in the oral cavity. It affects salivary glands. It affects the ability of the body to create saliva. It's a really not a good type of condition. So again, what do we have to do? We have to look at this as a total involvement of the autoimmune syndrome. And the autoimmune syndrome is the body attacking itself, right? I've talked about this many, many times. So what do? Well, it can happen all over the body. So let's do a test for lupus. Let's do a test for rheumatoid. It's very interesting. We can see sometimes that some of those traditional testing can come back positive. And in particular, we do a particular testing in our facility looking at your CD cells, looking at some of the autoimmune, the more obscure autoimmune tests that are out there that show us the shift in your cell counts, that kind of thing. So there are over 100 autoimmune disorders, and it affects millions of people. So they're more common in women. I think that is linked to estrogen. As a matter of fact, in terms of MS, there was an article out showing that estradiol may help a woman who has MS. So there are many things here, John, that we can do to look at this kind of thing, but you want to start with a great dental exam.
That's you've pointed out the importance of dental hygiene.
Absolutely, man. And it's not just, the toothbrush commercials,
Yes,
right?
yes.
Yeah, we got to
Right.
do the right things.
Right.
Okay.
We are coming up on our halfway point of the show. It is Health Watch every Sunday, 8 till 9, the live version here on Talk Radio 1210, WPHT. 855-839-1210 is the number here in the studio, and we have a couple of open lines, so it's a good time for you to get in here if you have a question for Dr. Molly or you have a medical challenge that you'd like to run by her. 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates. We both return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. The number, 856-489-0505. That's 856-489-0505. And when you call, all you have to do is make that appointment to sit down with Dr. Molly. The initial consultation is complimentary, and you will learn a lot about what she can do for you and potentially maybe can help you. You just don't know until you make that appointment. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210, WPHT. 855-839-1210 is the number here in the studio. We're going to pick up on this discussion and talk about some supplements.
Yeah. So, John, I know everybody's going to run out and try to get supplements for their autoimmune disorder and that kind of thing. I want to caution people a little bit about that. Obviously, we believe hydration is better because we realize that you can add these supplementation, these anti-inflammatories, these antioxidants to your diet daily. And again, I told you, we're not against oral products. I mean, there are some really good brands out there. We have no issue with that. But you've got to take into consideration your gut health when you're doing this. And let's be honest, if you have an autoimmune syndrome, do you not think your gut is involved in that? Of course it is. So again, we're going to need to look at things like probiotics, prebiotics, digestive enzymes are very important. So you can't just say, okay, so Dr. Molly said, let's go out and get ginger and turmeric and all of that. Well, yeah, but you got to make sure your gut is also in an optimal position to take that, digest it, and deliver it where it's needed. That is why hydration therapy is a great product, a great modality to deliver these anti-inflammatories for a patient with these type of syndromes. Not just because they can't swallow, it's because they probably have gut problems related to this oral problem, as well as others. So one of the things, again, we use is your favorite vitamin C. But again, I want to get a natural extract of vitamin C. Many times I'll use tapioca, many times we'll use cassava, many times we will use other extractions of vitamin C. Generally, we do not use a corn source because we believe it has too much sugar, but we have used it on occasion. So again, it's going to depend on what the patient needs and how we deliver. So everybody's a little different, even your vitamin C in your bag.
We should mention, because we've talked about this many times before you go into the health food store, get some advice from Dr. Molly and her staff, because if you just go in there blind, you may come out with 27 bottles of the same thing.
Okay. That's a great thing you just said. For example, we use NAC. You notice what I'm saying? NAC. Forget the name. It's big. It's long. It's an amino acid. Okay. All right. NAC. I tell a patient, well, you want to go get this, go get NAC. They came back with NAD. So what I'm saying, folks, is don't, really think about this. So we were delivering the NAC. Why aren't I feeling as good on this? Well, because we didn't put you on NAD. Okay. We put you on NAC, which is an amino acid. NAD is a coenzyme. Oh, didn't know that. I know. But the health food girl just put me in there. She said, all the N's are over there. I said, okay, very good. So the other thing we're going to use is omega 3s. And again, we want you to pick out the best. We have several brands, different price points. We don't sell them, John. I'll just tell you where to get them. You know that.
Right.
Okay, which I think is good. How about getting something like grapeseed extract, resveratrol? We want that. Everybody needs something like that when they have inflammatory disease. So this is another thing. Vitamin D. Vitamin D. How I love vitamin D. Vitamin D is important in all of our autoimmune disorders, right? And also very important for cancer patients. Now, here's a very interesting thing. Some people take 5,000 every day and they don't get into the normal range, which runs between something to 100 or so. Bottom line is this. You don't want too much vitamin D either. You got to be just right. My Goldilocks theory. I had a patient come in with her vitamin D level that was in the 300s. Well, that is not good. You want to bring that down. So maybe she shouldn't be taking 5 to 10,000 units a day. Maybe she should be cutting down to maybe twice a week. So you need advice with some of these nutraceuticals because they actually have components that are medicinal. Right? They're medicinal.
Yes.
And that's the point I want to make.
Again, back to getting advice.
Hydration and getting it right. B complex, you need a certain B. If you have a methylated problem, you're not going to be able to take the regular B complex that you can get off the shelf. You need methylated Bs. You may need things like folate acid as opposed to folic. I had a pregnant woman who had that problem. She was taking all the prenatals with folic acid, which we know are important for baby's health, but she was taking so much of it, it was causing her to have a problem. Switched her to a more natural brand of prenatal vitamins. She did very well. She had a healthy baby, and things are good. These are the things. Zinc. You need zinc. That's something we can put in the bag. Glutathione, one of my favorites, right? Glutathione. It's very important for liver health. It's a cofactor in helping us form some other amino acids that are necessary for us to just live and muscle mass, this kind of thing. So the bottom line on this supplements is if you have an autoimmune disorder, remember, you have to have good gut health to start in order to digest them. That's where you need a little advice. You may need digestive enzymes. You may need probiotics, prebiotics. You may need a myriad of things to do this. But the best way to get all of this is through the hydration therapy, because in our clinic in particular, because we do not use one size fits all. We're looking at the patient as well as the protocol.
And so the bottom line is hydration plus the supplements.
Yes, we'll give you some. The supplements that I'm talking about, we deliver in the hydration for the most part.
Yes.
But you will put you on some orals, but obviously not a whole lot, because we know you can't digest them.
So is there a number
No, I try to limit people. Well, I had a nurse, God rest her soul. She would let you leave with bucketfuls. You remember that,
yes,
and we
I do.
loved her for it. But the bottom line is, I think somewhere between 3 and 5 supplements a day is probably something people would adhere to. So if you can augment that with the hydration, man, you got it made.
Is there such a thing as prevention for autoimmune?
Well, it depends on what is the trigger for the autoimmune. For example, we found lately that people coming in with post-COVID are tending to have symptomatology of certain other autoimmune disorders that were triggered from the virus. And then the body turned on itself. What happened is the body was fighting the virus, went into overdrive, and now it's turning against your own body.
And guess what? We have our regular caller, our favorite caller, Frank in the Northeast. Frank, good morning. You're on Health Watch with Dr. Molly.
Hi, John. Hi, Dr. Molly.
Hey, how are you, Frank?
Dr. Molly, I don't know why I never thought about this before. I just popped my mind. I want your great listening audience to be aware. Yes, they hear you on Sunday. Yes, they'll go to your place for the initial consultation. But after that, everyone listening, Dr. Molly and her great staff is always walking around asking you in the chair, do you need anything? Are you okay? Not like you're in an infusion room all by yourself. There's always someone checking on you. If you want a kind bar, that's like a granola bar. Some water. I mean, the people there and you, it's not like once you have the consultation, they never see you again. You're always walking around, always checking on your people. You're one of a kind. Your place is one of a kind. I just want everyone out there to be aware of that. That's all. Just go
Thank you, Frank. Thank you, Frank. Thank you so much.
Thanks
God bless. God bless
you. You too.
Thank you, Frank.
Bye-bye.
And that's true, by the way. It is true.
Well, I know it's true. And I have a wonderful staff. I have wonderful nurses. And, nurses are trained to observe. You've heard me say that before. And they do one heck of a job in my facility.
And, the discussions also with the people.
Oh, my goodness.
We have some interesting discussions.
You know what I say? I said, I usually use this, I say, 2 doctors for opinion. Let me tell you something. My nurses can tell you stories about that. How patients are conflicted because they go to their infectious disease guide, then they go to their primary, then they go here. And they said, you know what, Dr. Molly, it seems like you and Dr. Pat and the other medical providers there really tell people what to do and how to do it, and then they adhere to it and feel better.
And that's
true. All we can do.
That's all you can do. We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge you want to run by Dr. Molly. 855-839-1210. That's our number here in the studio, 855-839-1210. Dr. Molly and I return with more of today's Health Watch right after these words. Back here on Health Watch, operators standing by right now at Innovative Medical. And they will be there not only while we're on the air, but well after we leave you at 9 o'clock this morning. But call now if you like. You're so inclined to do that, please do. 856-489-0505. That's the number, 856-489-0505. And like I said, when you call, you just want to make that appointment for the initial consultation with Dr. Molly. It is complimentary, and you will learn a lot about what she can do potentially and how she can help you maybe. 856-489-0505 and the website innovativemedicalassociates.com, innovativemedicalassociates.com. And if you're so inclined, you want to hear our show again, it's coming up again, 4 to 5 this afternoon, the Health Watch replay right here on Talk Radio 1210 WPH.D. 855-839-1210 is our number in the studio right now. If you still, we still have time to take some calls if you have a question or a medical challenge you want to run by Dr. Molly. We're going to kind of give an update on some patients.
That'd be great.
And you got you got an out-of-town patient?
I got 3 out-of-town patients coming in. One who's a return visit to us who has ovarian cancer. She's doing very well. We are helping her get through her traditional chemotherapy at an institution out of town. That's fairly well known. And we've been doing all the follow-up here. And as a result, her son was getting married this past weekend. She said she felt good. I got in her results, and a doctor and I were going over them from her latest CT scan. And it's very interesting because no new nodules have come up. Now, again, I'm going to say to you that do I believe that it's because she's doing the chemotherapy? Of course, that has a play in this. But I can tell you the chemotherapy she's on is quite vigorous, and probably because it's only done for several days every 3 weeks. So it's quite intensive. It's concerns some platinum metals, which are not, usually you don't tolerate them too well. She's sailing through that, and she said she knows it's because of what she does here and how she gets built up. It may be, she was told that initially the tumor was too large for them to do surgery. We think that together it is we're helping her actually get the surgery she needs to move forward and possibly be in better shape. And she's really doing well.
And reducing the size of the
right
tumor,
on.
obviously.
That's right. That's right. And the other two are coming in with autoimmune. Now, I'm not quite sure which one, what kind, because they claim they all had post-COVID. And as you know, I just was talking about that before the break, that sometimes it could be the virus triggered a response to the body because it goes into overdrive. Now, I did not get all the records that we requested. That's another interesting thing, John. You know, we like to see the records from another institution or other physicians. Many times, if the physicians, quote unquote, are alternative in nature, whatever, they don't want to share, I have no problem with that. But I'd like to just see the traditional history and physical kind of notes that can help us move ahead with the patient and maximize their time and visit here. And we do, for the most part, do just that.
Do you have is there a patient coming in with unknown skin disorders?
Yes, they're coming in this week, and that's part of the autoimmune thing that I think is happening. But again, I'm not sure totally because I can't get all the records yet. But we ordered them a week ago and still don't have them. But we will get them before the patient starts tomorrow, I'm sure.
I know you'll get
them.
Oh,
we'll torture them till we get them. That's the beauty of what we do.
Yes.
Because I really want to see what they've already done, and maybe have they done a biopsy on this. The patient was not aware of that. If they did. And that happens because you're so overwhelmed with what's going on. And I'm seeing, it's interesting, John, I'm seeing more and more skin disorders than I have in a long time. And again, I think some of that may be as a result of COVID. I'm not sure. I can't say this. Please don't hold Dr. Molly out. There's some nut about this. I'm not sure, but I think there has been an increase of autoimmune type skin disorders that are happening, possibly as a result of the viruses. Who knows?
Does it have anything to do with the sun and the summertime? And the heat
no, I saw this all through the winter too. I got to tell you, and I think it's really related to a lot of skin cancer is one issue, but these are like eruptions, so to speak. Rashes, that kind of thing. Very, very interesting. I'm telling you, we don't even know the half of what this virus, this post-virus, is doing to people. Again, I must pick up 2 people a week who have post-viral syndrome from COVID.
We are giving an update on patients, and I know you like talking about Joan.
Oh, Joan is a great gal. She went up there, as you know. We spoke to her interventional radiologist. She did very well with him. She does have a couple of spots on her liver right now, and again, they're minute. Now, I encouraged her to seek out, go back to the interventional radiologist and see if he can then do an ablation on the liver. That's something that is being done if the tumors are small enough and in a location that the physician feels secure enough to do that. And she didn't even know about that. She said because she has finished with the radiation oncologist, her traditional oncologist didn't mention that and started to talk about additional chemo. And I said, well, why don't you go back and see if you might be a candidate for this? So I'll know an update on that this week. But what I'm saying is to people, listen, there's always another bus. What we need to do is see if you fit into a particular category. And again, we're not going to make that choice for you. We're going to help you go back to your professionals or your conventional doctors and say, hey, is this an option for me? It's good to have, in other words, information is power.
And you've always talked about, and how many times have patients come to you and said, I went to, and you said it earlier in the show, I went to 10 doctors and they couldn't do anything for me. They said, oh, I can't do it.
No,
but
I don't want to believe that.
You never
I don't believe that. I believe there's someone out there who can help you, and I believe that it's just a question of narrowing down what the symptomatology is, what you want to accomplish, and how do we get you there.
Let's talk about Pat.
Oh, I love this one. Pat has an autoimmune disorder as well as a blood dyscrasia. And so it manifests itself in an anemia and low platelets. And so one of the things we talk about is what kind of nutraceuticals can help with platelet functions. Well, we know that colostrum can do that. Also, piperine, which is like an extract of pepper. But in doing the research in the last, I guess, maybe 3 or 4 months, we've noticed that a particular drug that was used actually for gout has been able to do this. And we were able to compound this because the FDA in their infinite wisdom took that drug off the market for IV, and it can't be getting. But if you use a great compounding pharmacist, you might be able to get it in a particular dosing that may help someone like Pat and help the doctor give it to you in an IV form that may help the platelets. So these are interesting things.
What's the prognosis for Pat?
It's great. Right now, she's doing very well. She actually said to me this week that she's feeling better. She was a little bit under the weather 2 weeks ago. She brought her daughter in, her daughter and son-in-law are very well-known chiropractors in the Atlantic County region. And we had a discussion about the nutraceuticals and a discussion on some other things, including some testing that they wanted me to do. And I certainly capitulated in that. Listen, I'll take information from any professional out there for a patient if we know it's going to work. And, we believe in the end, the big physician is the man upstairs, right?
You've talked about a lot of nutraceuticals during the show today.
Sure.
And you've always talked about a lot of them.
Yeah.
In leaving today, can you tell us maybe one or two that you take?
Vitamin C, of course. Vitamin
yes.
C goes without saying.
I take that every day.
I know. Liposomal C, right? I believe sometimes if you're a little anemic, you ought to get a good iron. And in this case, I have a wonderful iron product, and you're taking it. It changed your life. It's doing well for you. And again, here you go. Do I just say it's just what we give you in the bottle? No. We have to do some things along with some traditional meds for you, John, and that's what's working. So if it's working and it's not broke, let's not fix it. Okay, but there are many things out there, so that's another thing. I look at lots of different. I think the anti-inflammatories are very important. The turmeric, curcumin, those kinds of things for the inflammatory process. But again, you have to have good gut health to take them. That's why I love delivering them IV.
And before you go to the health food store,
please
get some advice.
Absolutely,
from Dr. Molly
or my staff,
or your staff, because
thank you.
Just don't go in blind.
No way, no how.
And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, operators standing by at Innovative Medical Associates, and they will be there well after we leave you at 9:00. The number 856-489-0505, 856-489-0505. Don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And also, don't forget, if you missed any of today's show or you just want to hear it again, our Health Watch replay this afternoon, 4 to 5, here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nurses, Lana, Donna, Jess, Jim, and Daniel, and of course Joanne, delightful D, fabulous Fran, and our medical assistant Sandra. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.